The tree of sound enhancement therapy is the developmental flowchart for the correct administration of any sound-based therapy. The concept revolves around the voice-ear-brain connection, as presented in the Davis model of sound intervention. Our body rhythms start at conception and develop as the fetus grows, and then mature and stabilize as the baby is born, grows, and develops. The seed of the tree of sound enhancement therapy relates to our core, or our basal body rhythms. These rhythms refer to our heart rate, breath stream, and cellular rhythmical patterns. We all inherently have these rhythms directing our everyday functioning. Occasionally, these rhythms do not support our ability to function maximally in learning or developmental tasks, or help us maintain our wellness. Support with therapy at this level of the tree can be addressed at any time before or after any of the other sound-based therapies. Sometimes, because this level of the tree is our foundation, the only recommended therapy is at this level. As a seed grows, roots are established. All seeds have roots. But how healthy are the roots? As related to humans, to function maximally, our roots must be strong, well-fed, and remain supportive for our lifetime. The root system of the tree of sound enhancement therapy is connected with the development of the ear, specifically how the acoustic reflex muscle in the middle ear cavity supports reception of sound frequency in the cochlea, as well as in the vestibule and semicircular canals of the inner ear. The sense of hearing is addressed at this level. The muscle reflex can be compromised at any time in a person's lifetime, meaning that it may be overreactive, underreactive, or not have enough muscle tone to support good responses to sound vibration. Some commonly seen causes for this may be early middle ear infections, weak immune systems, subjection to loud sound, or poor general muscle tone. The type of therapy used at this level of the tree is called auditory integration training. When issues associated with one's sense of hearing are evidenced through testing, it has been our clinical experience that this level of therapy typically must be addressed prior to some of the other sound-based therapies for optimal benefit. When the roots are healthy, the tree begins to grow its trunk. The trunk reflects how our bodies process sound vibrations. Sound is not processed only through our cochlea in the inner ear. It is also processed through our bone structure, cell network, nervous system, and circulatory system. Sound processing is more than hearing. The vibrational energy of sound waves and patterns travel to and through our body. The connections between the voice, the ear, and the brain are established at this level by stimulating vestibular function, language skills, and attention, focus, organizational needs. Special music and sound are processed through the air in the ear canal and or by the bones of our skeletal system to help repattern the body's foundational responses. Once the process has begun, the person's voice is introduced. The voice establishes a type of beneficial feedback that helps the listener stabilize and enhance the processing of all incoming sound with better clarity and understanding. The therapies used at this level are called listening training programs. This level of the tree must be strong and supportive in order to maximally develop the integrated communication, academic, social, emotional, attention, and vestibular skills needed for learning and development. As the trunk is growing, the leaves and branches begin to sprout and grow. A healthy tree has strong branches with healthy leaves that demonstrate its overall beauty. The branches must be strong to withstand nature's surprises and everyday wear and tear. The leaves should not wither from lack of nutrition or support through the trunk of the tree. The skills at this lower leaves and branches level of the tree of sound enhancement therapy are specific to auditory processing skills such as memory, discrimination, sequencing, and localization. These skills are very necessary for the development of academic-based skills as well as attention and listening skills. But without them well established, learning and listening can be frustrating and/or difficult. There are many therapies that support positive change at this level, but they should only be introduced when the lower levels of the tree demonstrate sufficient support and skill. Otherwise, the person may develop many splinter skills and not integrated skills. As the leaves and branches maintain their healthiness, the final academic pieces can be processed more easily. A person can develop rudimentary academic skills, have difficulty with types of skills like phonics, and stay focused for short periods of time without having the earlier growth of the tree of sound enhancement therapy be maximally healthy. To maximize the academic skills, such as reading, handwriting, spelling, and math, the flow of information from the roots through the lower leaves and branches must be strong and supportive. One can teach these basic skills with tutoring or special programs, but unless the information is flowing easily to understand simple basics, such as the rhythm of language, the movement of handwriting, or the discrimination of phonemes, the skills are not fully integrated. Once the foundational skills associated with the various levels of the tree are connected and stabilized, the academic skills develop on their own, and additional supportive service needs are minimized. If therapy is needed at this upper leaves and branches level, the program must incorporate auditory, visual, and language skills within the program. The developing tree is superimposed upon the head because of the importance of the connection between the voice, the ear, and the brain. The voice reflects the inner harmony of the body. Everything in the body has been identified from the frequency emissions of the cell structures, as well as the emissions from the inner ear. These frequencies are reflective in the voice and through vocal analysis. Frequency equivalence associated with various wellness challenges help support the body towards a more natural form and function. This portion of the tree of sound enhancement therapy is labeled overall maintenance and support because the voice is the tool for change. The therapies at this level use vocal analysis to initially identify various wellness imbalances and then support change by listening to special sound protocols. Or they use a technique called ototoning, which allows the person to use his own voice to support his own natural change by using the sounds emitted by his ear. The head demonstrates how the voice reflects what the ear hears and emits, and the brain receives, perceives, and sends to the body for use. The overall tree analogy demonstrates the voice-ear-brain connection established by 5 laws, which is further explained in the section called the Davis model of sound intervention. This tree analogy is key to understanding how sound affects our overall ability to learn, develop, and maintain our health and wellness.